Hello, my name is Dr. Rob Bennett. I am the Director of Inpatient Behavioral Health at Niagara Falls Memorial Medical Center. To the side of me, I have Kevin Burgess, who is the Director of Outpatient Behavioral Health Services. And we just wanted to share briefly with you some things that reduce the fear about mental health during this time of COVID-19. You want to add anything to that, Kevin?
Yeah, so we're going to talk, just briefly, we're going to talk about anxiety. We're going to talk about the services that we offer here at the hospital regarding outpatient behavioral health and psychiatric behavioral health. And then we are going to post some materials that were put out by the Office of Mental Health on dealing with stress and anxiety during this COVID-19 crisis. It's too much to go through in one short video, but we will post those resources on our Facebook page at Niagara Falls Memorial Medical Center for people to take a look at. There's going to be resources and phone numbers and tips and tools for dealing with stress and anxiety.
So one of the things that you can see that we are doing is practicing social distancing. I think that is really huge with reducing some of the anxiety that may be out regarding the COVID-19. Also making sure that you are really practicing all of the other safe things with regards to this, such as making sure you use hand sanitizer if it's available, washing your hands, wearing protective gear if you have it, trying your best to do the minimum of getting outside, but also really protecting yourself. So again, those are some of just the overall things that can reduce some of the anxiety, really getting the facts and not just kind of buying into all of the different things that may be out there, because we understand that this is a tough time. A lot of people have questions about mental health, questions about how do I deal with my own anxiety, and then if you have a mental health condition, things have changed a little, and how do you navigate that during this time? So is there anything you might want to add to that?
Yeah, I think it's important when somebody has anxiety, or maybe you've never had anxiety before, but you do now because of the crisis. We want to make sure that we stay in our normal routines as much as possible, stick to scheduling things, even if you're stuck at home, scheduling and sticking to routines on making breakfast, making lunch, making dinner, and like Dr. Rob here said, limiting your exposure to too much social media, too much news about COVID. Social media is a great thing. Just don't focus on the COVID-19 crisis. There's lots of other things you can do to kind of keep your mind distracted and keep yourself busy, and scheduling things and engaging in different things on social media or our virtual platform are some of those things. And some of the resources that we're going to post are going to go into certain examples of things you can do to maintain a schedule and maintain some sort of distraction, and keeping your exposure to the COVID-19 crisis as limited as possible while still staying well informed. So we're not saying, don't be well informed, check on things maybe once, maybe twice a day, but continually having that in your life, we want to limit that because that's going to decrease the anxiety.
So really, again, I think what's important is the normal routines. Staying connected to your family and friends, especially through social media, through Skype if possible, looking for activities that you can do when you are at home, getting outside just for short breathers to get the fresh air. Those are important to helping us maintain good, positive mental health. What we do want to address is some of the services that we provide. Again, I'm the Director of Inpatient Social Work. Most of the people that come to our program come in through the psych ED. It's really important at this time, as we're dealing with COVID, that if you are presenting to the ED, that it really is because of something that is much more severe, say for instance, psychosis, something of lethality, like suicidal or homicidal thoughts and things, that's really when you should present to the ED. Otherwise, you probably should be seeking some resources through our outpatient program, and we have plenty of different resources, including telemental health, which can kind of help you get some tools on how to resolve anxiety or really deal with some of the other mental health disorders that may be out there.
Yeah, so just like Dr. Rob said, outpatient maintenance of anxiety and stress is probably your best solution. It's not really an emergency room type of a need. And we are still open and providing services here at Niagara Falls Memorial. We have our main clinic on the 6th floor at the hospital. We are providing services to all of our current patients, mostly through telephone. So we can do anything over the phone that you would normally be able to do in the clinic, including see your counselor, see your doctor. And if you're a new patient or you want to link to services, we can do all of that over the phone as well. But I do want you to know that we are here in the building, so if phone for some reason doesn't work for you, we can see you in person as well. We can set it up so that we have a phone for you, and we can put you in an office if you don't want to be face to face with somebody on site if you don't have your own phone. So really, we can kind of accommodate any need that you may have to get services. So new patients, current patients are all welcome to come to the main clinic. If you want to call to set up an appointment, that number is 278-4541. All of our satellite offices associated with the main clinic are all still operating as well, mostly through the phone, but you can present to them in person as well. That's our Golisano Center has a therapist who provides services there. Our OBGYN center here at the main hospital campus has a therapist as well. And our Summit Healthplex Primary Care has a therapist there as well. The numbers for those are at Summit, you can call 215-0728. For Golisano, it's 278-5199. And for the OBGYN Center, it's 278-2423. You would have to be a current patient of one of those centers to either see the therapist for the first time or continue your services there. If you're not a current patient of one of those, we would ask that you come or call the main clinic in the main hospital on S6. There are also national resources. The one I do want to put out there, there's a national COVID support line. So let's say it's after 8 to 4 and our clinics are closed. You can call the national COVID support line. That's 1-844-863-9341. And locally, we do have the crisis services hotline here in Niagara County that normally does deal with more crisis, suicidal, homicidal patients, but right now they are fielding a lot of calls on anxiety and stressors related to COVID-19. And their number for Niagara County Crisis Services, and they told me I could give this out and direct people to call, is 285-3515, and they're 24 hours a day, staffed with licensed professionals as well. I do have some other numbers and phone numbers and resources we'll give out, but those will be attached to the document that we're including.
So just to wrap things up, if you do have to present to the hospital or the ED, we have taken every precaution possible. So people are screened at the door. We screen for temperatures. We do give out masks. We are wearing protective gear when necessary. So you're not coming into an environment that's unsafe. But we also want you to use all of the other resources so that we can provide our services to the people who need it the most. Again, we will be posting some additional information, and please review that information, look at it. If you do need some help with some emergency psychiatric issues, then definitely come. If you don't, please use our outpatient services and use some of the other resources. And again, we just want everyone to stay corona safe in a sense, and continue to practice good mental health when possible and really reduce some of the anxiety related to this.
And just in closing, that number again for the main clinic on S6 is 278-4541, and we're here Monday through Friday from 8 to 4.
Thank you.
Thanks.